Hi, this is Pat McDonald, your host for Vote for Vermont, where our tagline is listening beyond the soundbites. Today, joining me in studio is Dan Barlow, who is the Executive Director of People's Health and Wellness Clinic. Welcome.
Thanks, Pat. Glad to be here.
Yeah, you said the last time was 15 years? That's a disgrace.
Well, I think you've interviewed me since then, but that might have been the first time 15 years ago.
Yeah, maybe.
Yeah.
Oh, it's amazing when I look back, because we've been doing this a long time.
We have, and I have to say, as a former journalist, you are a good interviewer. I know you do your research.
Oh, I do.
That shows up in the questions.
Yeah, thank you, because that's the part I enjoy the most. But I enjoy, because I know most of the people that I interview, but so it's not like I'm meeting somebody for the first time. But the research, you find out all kinds of things.
Yes.
Very interesting. So while we're talking about that, why don't you tell our viewers a little bit about yourself? And
Sure. It's interesting, Pat. I'm turning 47 this year. And I started looking back on my professional career, and I realized I spent my 20s as a journalist, my 30s as a lobbyist, and now I'm spending my 40s working in healthcare. So it's an interesting transition. I see the linear path through all of those issues. But yeah, I worked for the Brattleboro Reformer, the Times-Argus. I covered the State House as a newspaper reporter, and then spent 10 years with Vermont Businesses for Social Responsibility as a lobbyist at the State House. A couple years doing some Medicare for All work on the national level, and then the pandemic hit. And then about 3 years ago, I became the director of the People's Health and Wellness Clinic, which is located right in the town I live in, Berry City.
Right. And did you move into the new building when you took this job, or were you in the other building by the police station?
Yeah, great question. This is important, because I always have to remind people we did move, just like ORCA moved.
Yeah, right, we moved. We're not downtown anymore.
So we were in there for about 6 months when I started at the clinic. So, and just so the viewers know, about 4 years ago, Tom Lozon, the mayor of Berry City, he owned the old Berry Granite Association building downtown. It was empty. No one was doing anything with it. And he came to my board with this really unique real estate deal. Where my board raised about $500,000 to purchase the building. They formed an LLC, and the investors earned tax credits over the time of the deal.
Right.
And so we're technically a tenant of the building, but we have 6 years left on the mortgage.
Great.
Once that's paid off, the LLC goes away, and the building is gifted to the People's Health and Wellness Clinic.
Now that's a deal.
Absolutely. So this is our permanent home in
Tom
downtown.
Lozon.
Tom's a great asset for Berry City.
I don't think people have any idea half of what he does for that city.
Yeah.
He really does love the city.
Yeah, and I was going to say, I'm a liberal, and I know Tom's a Republican, conservative.
It doesn't matter to him.
Doesn't matter at all. It's about community,
Exactly,
so, yeah.
Exactly, and that everybody can agree on. And that is a great building. I was there for a meeting one time, and they had in their boardroom a marble boardroom table. Have you ever seen that thing? They moved it down to the Granite Museum.
I saw pictures. Yeah. It was gorgeous.
It is just, it's stunning. It's just, I don't even know how they got it in or out of the building, and I'm sure they have to worry about the weight load of that thing.
Yes. It was a complete gutting. I think the only thing that really still exists was the granite stairway going up to the second floor.
Okay.
So
did you have any say in that and how to?
No, again, I came in about 6 months later, but it was definitely geared towards this being a medical office.
Oh, great.
So it fit us better than the old location where we had to kind of adapt to the flow of the building.
Yeah, that was a little tight, that building. Plus, you're right next to the fire station, which probably didn't help when people weren't feeling well.
And we were in the flood zone. If we had been there 2 years ago, we would have been gone, So, yeah.
That's sad. Well, let's talk about the clinic, because it's just fabulous. And could you talk about its mission and its purpose? And
absolutely.
Because it is a gem.
Thank you. It really is. So for over 32 years, the People's Health and Wellness Clinic has been a safety net for people who are kind of falling through the cracks. Some of our patients are unhoused and they're in crisis. Other people they're just folks maybe who they lost their job recently and they need some help with health care, or they're working people and they're just kind of still struggling to pay for health care. We're the clinic that serves them. Everything we do is 100% free. to the patient. We don't charge Medicaid, we don't charge insurance companies, we don't charge the patient at all. And we use this hybrid model of volunteers and staff. So we have a really small staff. It's 5 of us, but really 3 full-time jobs among the people. And then about 30 volunteer doctors and nurses and dentists and mental health professionals who come in either once a week or sometimes once a month to see patients.
You don't even charge Medicare? Or
It's interesting. We're actually
I got stuck on that. And
I know.
How do you do this?
I kind of wish we could, but we are actually prohibited by federal law from billing anyone. In exchange, we do get free medical malpractice insurance through the federal government.
Well, that could be a big chunk too.
Absolutely. This saves us a lot of money. So we do have a legislative allocation, and we can kind of talk about that later if you want. But for the most part, about 55% of our funding is just raised from the community. It's local businesses or donors, or we do fundraisers. So I'm always hustling to keep the money coming in.
I bet that's right.
Yeah.
So where your clientele or your customers, that would be clientele, I think. How big is it here? How many people are uninsured or underinsured?
Yeah, it's a great question. It's interesting. When I first took this job, I looked at some of our historical data. So I went back to 2007, and that was before the Affordable Care Act. And back then, 90% of our patients were uninsured. And since then, our last year's data shows that about half our patients are uninsured. The other half are usually on Medicaid, but they can't find a primary care doctor because of the primary care doctor shortage. So they've been coming to the clinic. We see about 700 unique people each year, most of them right here in central Vermont. Every once in a while we get folks from other parts of the state coming over to see us too. And each year, about 300 of them are brand new to the clinic for the first time. So we do have a few hundred people who are using us as a primary care office, either because we built that trust with them, or they're just permanently locked out of the healthcare system, and they come back to us year after year for their care.
Well, when I first moved here, in my church, there was a young couple. They just moved to Vermont. They had 2 little kids, and they went to your clinic, and then since then they've gotten jobs and not gotten. They got their own doctors, but they raved about the service. They raved about everything. I mean, there was nothing negative about anything they had to say, and that's the first time I really understood what you did there. I saw the sign and, okay, cool. But then they were really so passionate about it that they really liked it.
That's
appreciated the service, obviously.
Yeah, that's great to hear. I mean, we pride ourselves on the quality of the care. I know all the providers and nurse, they're there for the mission, Right. For the most part, our patients are just really appreciative because if we didn't exist, quite honestly, they would have no other place to go except for the emergency room at the hospital.
Yeah, I bet you don't wait 6 hours in your
Nope.
You got to put up a whole evening if you go up there.
Yes, you do. Yes,
you eventually get great service, but I've been there 6 hours or so, and one time somebody said to me in seriousness, "Oh, is that all?"
Oh, wow.
Really? Maybe we should talk about something here about organization. But, people need the service, and they don't have enough doctors these days.
Absolutely.
It's just what happens.
Yeah.
It's really sad. So the nurses?
Yeah, we have nurses,
Nurses and doctors, do you approach them? Do they come to you? I mean, how does that work? Because you must have a close relationship with Central Vermont Hospital.
Oh yeah, CVMC has been fantastic to us. They're a big donor, and actually about a couple months ago, they put out an email to their whole staff urging them to come to the clinic and start volunteering. And we got several new providers and several new nurses because of that.
Great.
So people find their way to us sometimes, and also I've started this trend where when our providers, finally retire, usually for the second or third time, and will really retire, I tell them they have to bring the replacement before they're allowed to leave.
Exactly.
So
Exactly. There you go. Yeah, and you also had something recently, whether it was a grant or something from Gifford.
Yes.
That was very nice. I read that.
Yeah, that's really exciting. And we have this great, our staff nurse, her name is Teal Church. She's a director of clinical services there. She is fantastic, and she formed this partnership with Gifford.
Great.
So every Wednesday morning we have this provider there named, I'm sorry, I forget her name. I apologize if you're watching. And she comes down Wednesday mornings, and we do walk-in addiction medicine. So if someone is, ready to go down that route for recovery, they can walk in. It's low barrier. The doctor's there to meet them and begin them on that journey to recovery. And we usually couple this at the same time. One of our tenants is Vermont Cares, and they do harm reduction work.
Right.
So we'll couple this when Vermont Cares is doing their clinic and handing out like clean needles or fentanyl test strips. We'll also have our recovery doctor right there for folks who are ready to leave drugs behind.
I'm just trying to remember, because I think addiction is something new, relatively new for you, correct? It's not something you've been doing all along.
Yeah, it's. I think we have to respond to the needs out there. And I was talking to our medical director is Dr. Alan Ramsey. He was one of the original Green Mountain Care Board members.
Oh, I knew that name. Yeah.
Yeah,
right.
and he's been there for 20 plus years, and he said, back then it was people with high blood pressure or high cholesterol,
Right.
and now we're seeing people who don't have a place to live, which obviously impacts their health in a huge way, or people who have untreated infections. They have cancer, really serious medical conditions that for one reason or another aren't being addressed.
Wow.
Yeah.
That's really awful. That's awful. What if I went right to COVID when you said that? What did you do in was about 2 years, I guess, of COVID? That must have been a nightmare for you guys.
It was. I mean, it was a little before my time as director, but we shut down for a good 6 months. And actually, I think a lot like the larger medical healthcare field, this was the reason to start doing more telemedicine.
Yes,
like all the excuses not to do something kind of fell away. And we're like, okay, we need to get online.
Yep.
So we really, invested in, getting laptops, the Zoom cameras, iPads for our patients too, so they can, come, they could just stay at home and talk to the doctor just over, a video call.
Yeah, because I was on the CVHHH board for a long time and still are involved with them. And they had the telemedicine and they were showing us how it works. And it's really amazing. It's such a great service that you're right there. It's a phone call away.
Absolutely.
And they can tell your blood pressure and all this stuff. It's great.
Yeah, I mean, almost like 90% of what would happen in a primary care visit can actually just happen over a video call. And especially if you already have that relationship with the doctor you're meeting with, right? Like, you've met them before in person. So seeing them over video, you have still that personal connection with them.
Yeah, that's great. That's really good. Do you do house calls at all? Well,
No.
I just would think at some point you've got to pass. There are some things I'm sure you can't handle.
Yes.
And you've got to pass them along to somebody.
Yeah, we're by appointment only for the most part. So we try to stress to people we're not in urgent care. Because, again, we use volunteers. So there are times when, people have showed up, with blood running down their face. And I don't have any doctors or nurses there, because I'm just there doing paperwork, So that's one of our challenges is to set the expectation. But, if they need to come in for an appointment, get their blood pressure checked, get their meds refilled, that's what we're really successful at is, getting them stabilized when they're not in that, moment of crisis right there. So we don't do house calls, but we do pop-up clinics. During this started during the pandemic as well, we would go up to the hilltop where people were staying once or twice a month and do a pop-up medical clinic right there. And really all we need is some private space, running water, electricity, and Wi-Fi. And then we can just set things up.
Yeah, because I'm sure people lost their cars. They have no way, and there's hardly much transportation around here.
Yeah, it's really tough. Transportation is a major problem for a lot of our patients. So,
are there other clinics like yours around Vermont?
Yeah,
there are.
We're part of a network called Vermont's Free and Referral Clinics. So there's 8 of us,
that.
and actually there's a new clinic that just opened up in Burlington, and I think they're not part of our association yet, but I'm going to go visit them, probably later this summer to see how they're doing, and they're just operating 1 day a week right now. So yeah, there are 8 clinics all throughout Vermont, and they're all different. We're all independent organizations, but all part of the same association. Right. Some clinics might just do helping people sign up for health insurance or like financial assistance, and those are usually attached to a hospital, and then there's ones like us, and we do, navigations for healthcare as well. We help people sign up for, food stamps or housing, whatever they need. But providing the care is the big difference. So 5 of us are providing direct care. Bennington, Rutland, White River Junction, here over in Barrie, and then Middlebury as well.
Oh, nothing up north, huh?
It's a complete, they have the federally qualified health centers up there, but there's no free clinics. There's a big need up there.
I bet there is.
Yeah.
Because there's a lot of folks up there that I'm sure are not working and need some help. And what do? You just sort of mentioned, you're seeing this individual who's got a health problem, but I'm sure they have food insufficiency, et cetera, et cetera. Do you connect them with other people? I don't know, like Capstone or something like that, where they can go and get the other help?
Yeah, we work very closely with a number of partners, whether it's Capstone, Good Samaritan Haven is a great partner of ours. So we have a woman on staff, her name's Stephanie Pinard. She's a community resource specialist. So she'll help people sign up for health insurance, help them fill out, whether it's Medicaid or Vermont Health Connect, help them, fill out the housing vouchers, almost anything they need to do. Like she's helped patients open up their own mail because they've had like a psychological block with opening up their mail. So we really see we're a non-judgmental place, and really we often ask, okay, what do you need and how can we help you? Right. And we're going to do our best to do that.
You must see, before Mary retired, I did some shows on mental health, and I have to do one again soon, because it's not getting any better, is it?
It's really challenging, and actually that's a big gap that we have at the clinic, is we don't have any mental health counselors right now. We had some before the pandemic. I think we all know how the pandemic was for that profession, and right now actually our last one just retired in January.
Oh, wow.
So really we have to refer to Washington County Mental Health, which I know there's a long waiting list there too. Yep. So that's a big gap for our patients, and I think we've done a really good job at the clinic of adapting to substance use disorder and addressing that with our patients, but general mental health problems is still a big gap for us.
I bet. And what happens in an emergency? Do you? Because I know the police and mental health people go out. They have this. It's a group. I can't remember what it's called, but they go out together because for a long time they were asking the police to do stuff that they're not trained to do, and so they were bringing people with them that could help mitigate the situation.
Yeah.
Do you have trouble? You must have some problems in your office with people you can't help, maybe.
Yes, this has been a growing problem. I think folks know that I think it's approximately 1 out of 3 healthcare workers, have been assaulted at some point during their career. Yeah. So this is a field where, unfortunately, the people on the front lines sometimes. Experience violence. We haven't had violence at the clinic. We've had some uncomfortable moments with people who are usually, they're in crisis. Yeah. They're having a mental health breakdown. Yeah. And I know they're not acting rationally, right? And I've actually been really impressed with the Barrie police at their ability to de-escalate situations. Yeah. They already know the person that they're there because they've encountered them before. And they're really good at bringing the temperature down.
That's great.
And I know the Barrie City Police also has a social worker on staff that works directly with law enforcement.
I think it's called Team 2. I don't know why that name rings about. I just have it there somewhere. It's Team 2, and that we did a lot of shows on that because the police were like, I don't mind, but train me. Yeah. Because with one mind, you're saying a thing that makes sense, but maybe to the other person, it makes no sense at all. So
absolutely.
They've been trained a lot, I believe. Yeah. Which is good.
And if you don't mind, let me give you kind of an example of we had a recent situation. This was a few weeks ago. So right next to our clinic is Good Shepherd Church. And oh, great, yeah, and they've been doing the warming shelter in the mornings, which is great for us too, because we can just pop next door and see some folks who maybe need care. But a few weeks ago, we had a gentleman out back who I think was at the warming shelter, and he was just screaming obscenities out in our back parking lot. And then at some point in the morning, made his way into our waiting room and then locked himself in our bathroom. And he was in there for a while, and for us, that's usually like a red flag for drug use.
Right.
And we want to knock, make sure someone's okay, they're not passed out or need medical attention. So we knocked, and he's like, I'm fine. And we checked back later, and we made an assumption about this gentleman that he was doing drugs. It turns out he was in there, he had frostbite on his feet because he was walking around in wet socks and wet boots in late winter. And he was trying to bandage his feet with toilet paper.
Oh, the poor man.
And so we all just jumped into action. My nurses got him the medical care he needed. One of my staffers went to the thrift store down the street, bought him a new pair of boots. We had clean, fresh socks there we could give him. And then someone else went over to the church and got him a hot meal. And the reality is that this took hours to do. And it took 5 or 6 of us, right? But this man who started his morning kind of screaming in pain out back, he left with new boots, new clothes, warm food in his belly. And for us, that's often that's a success story. That's a victory.
Sure.
Yeah.
I go home feeling pretty good.
Yes.
That's right. Oh, God bless him. There's a lot of folks out there like that too.
Unfortunately,
but
yes.
You know what I found? Most people who are homeless are, in my experience, the nicest people. Just, what's the expression? Shit happened. I mean, it just they don't want to be there, but they're very nice. I've met them on the path when we were doing bike paths and stuff. And I actually had somebody help me. I was carrying my soup into the luncheon that they do on Wednesdays. And this guy who was down having lunch, he got up, helped me, got my car. I mean, he was the nicest man ever. And I thought, and here we are thinking other things. Shame on us.
Absolutely.
Right?
I think we all have a tendency to stereotype, and we often hear about the worst of the worst, right? And then the social media groups and stuff like that. And 99% of the unhoused folks I've met, they are great people, and they are just in a bad space at that moment.
They don't want to be there either.
Right, and usually they've had a lifetime of trauma or poverty and sometimes addiction, or all three, you know? So
yeah, it's really, I watch on there, I don't know, people are, don't go, they were afraid when I worked at Barry City, there was a couple of stores that were afraid to go out at night because of and I'm like, have you ever heard of anything happening? No. They probably help carry your boxes.
It's true.
I mean, seriously.
Yeah. And for me,
nice.
Barry City, it's my home. I live about a 5-minute walk from the downtown, and I've been in Barry now since 2014 is when we bought our house. And so I'm downtown every day. My life is 3 blocks in Barry, you know?
Have to get out a little more.
And I always feel safe, you know? And I think my car was broken into once 10 years ago, and maybe an iPad stolen, but I left the door unlocked, you know?
Right,
so it wasn't smashed open or anything. So it's like any other community that struggles a little bit.
I always say with Barry City, as compared to I think Montpelier has just as many non-working people but they've got a lot of downtown at night. They have a lot of people, so they kind of blend in, and you don't notice. But if you remove those people, you'd see that they've got pretty much the same number of folks that Barry City has.
It's absolutely true.
They're right there.
Yeah, and a lot of the folks, they move back and forth from Barry to Montpelier too.
Right.
So
yeah, that's really sad. Well, God bless you. That is great. I bet he's going to talk about that to his friends, and they'll come and get some help. Because,
I hope so.
You treated him with respect and.
Exactly. Yeah. Respect, no judgment, and I think one of the benefits of we're being a charity and we don't bill anyone and stuff like that is we're not pushing people out the door.
Right.
We're not asking for money up front or anything. Again, we're just asking what's wrong and how can we help.
Right. And what? I'm trying to find the right words here. From a operations or surgical things. At what point you don't do surgery?
No.
There, you just do. You do broken legs and that sort of thing?
No, not really. We'd probably have to refer out for something like that. Right. The closest we get to surgery is we do tooth extractions. We have a retired dental surgeon, Dr. Noble. He came to us last year. He is a snowbird, so we're all waiting for him to get back from Florida later this month because we have a long, I think he's already booked into August, you know.
Wow.
But that's been incredibly popular is the tooth extractions for us. But yeah, we can't do surgery or anything like that. We'd have to refer out to someone.
But
we
can do medication, prescriptions.
Exactly. We can do blood draws to get some tests done. Some of the stuff we can do in-house. Some of the stuff we send up to CVMC for them to do the work.
Oh, good.
Yeah.
Now, do you have to pay them, or that's part of their deal with you?
Actually, I just struck a deal with them this month that they are going to give free labs and testing for our patients.
That's fabulous.
I can't say
Hats
enough
off.
good things about Central Vermont Medical Center. They have been a great partner for us.
I bet, that's great. Well, they would have to, you're helping them with their workload.
And I remind them of that.
Yeah.
Yeah. Every patient that walks in our clinic is a patient not walking in your waiting room.
7 hours in the emergency room.
Yes.
So, really. I was looking at, you have a wonderful list on your website, and I noticed that physical therapy, that looked like it was a little newer service.
Yeah, and we try to do kind of as much body work as we possibly can. Right now we are doing massage and acupuncture, and both are really, really popular for people with chronic pain.
I was going to say, do you have to go only if you don't have medicine? I mean,
yes,
I couldn't sneak in. That's my favorite thing in the world.
I'll call you if we have a cancellation pad, okay?
Right there. Oh my God, yeah. But on the teeth thing, I have read so many articles about. It's more important than a whole bunch of other things. If your teeth are messed up, and a direct line to the bloodstream and all that stuff, you've got to keep those teeth in good shape.
Absolutely. And it's clear, seeing a dentist twice a year, that preventative care goes so far in keeping your teeth healthy for your lifetime. In addition to not smoking and your diet and everything, what we often see is patients who maybe didn't see a dentist in their 20s and 30s. They probably saw a dentist when they were a kid, and then a huge gap until they come to us. And unfortunately, at that point, they probably need numerous extractions. And then there's what we can't do, unfortunately, is help people buy dentures. And that we're running into that problem a lot. A decent pair of dentures, like tops and bottom, might be about $3,600.
Ouch.
And yeah, for our patients, forget it. You can't. What's interesting is Vermont is one of 12 states that doesn't allow people on Medicaid to use their dental allowance towards purchasing dentures. And I've talked to the legislators here. I think this is an easy change. Almost every other state does this. And people on Medicaid in Vermont, they have a $1,500 annual allowance for preventative care. Well, that could buy a top or a bottom pair of dentures for them, and then the next year they get the other one. And that would be life-changing. It would affect their diet, their social life, their prospects for getting a new job or a different job.
For sure.
Absolutely. Yeah, absolutely life-changing for folks.
Just appearance of having teeth when you're on a job interview. That's important.
Yeah, I mean, we hear from patients who, after the pandemic, they kept on wearing masks, not because they were concerned about germs, but they wanted to hide the state of their mouth. And that was so sad for me to hear.
That's terrible.
And parents telling me that they don't want to go to the parent-teacher conference because they'll be judged about the state of their teeth. Because we do have a culture where, we judge persons' status in life based on the healthiness of their teeth.
This sounds like something our legislators would jump at. What's the deal?
I've struggled to figure out what the barrier here is. I don't think it would cost much more because we're not saying give them more money. We're just saying
use it differently.
Exactly.
That sounds strange.
Yeah.
I wonder what the deal is.
I feel like there's a part of the story I can't quite get to, But
have you talked to the local, like Ann Donahue is on the health, and I think Ann Cummings is too. She's on.
I should reach out to both of them. We've been before both the House and Senate healthcare committees, and we've mentioned this before.
You need to start with one or two people and let them be your spokes.
You're right. I'll get my bill sponsor, and then
No, really, that's sort of how it works.
Yes. Yep.
If they've got somebody bugging them at lunchtime, they'll. That almost sounds like a no-brainer, but you're right. Where's the hitch here?
Yeah, and again, I don't know what it is. So,
Interesting. Well, we'll just go find out. So, and you also, obviously, mental health is here, and But that's hard. That's hard if you don't have somebody there.
Yeah.
You must work very closely. You mentioned already about Central Vermont Health. No.
Washington County Mental
I
Health.
always do that wrong. Washington County Mental Health.
Yeah, and actually just this morning I had coffee with Beth Seitler, the director over at Washington County Mental Health, who took over, from Mary about a year ago. So and Mary just like leaves big shoes to fill, and
sure.
Beth is fantastic. So I'm really looking forward to working more closely with her. And I know they have the plans for the walk-in access hub, I think, and that sounds really exciting and definitely needed.
The people that work over there are amazing.
Incredible.
And Mary, and I'm sure this woman is too, they walk the walk.
Yes.
They live it, breathe it, and you have to when you're in that business.
It's true, yeah. Yeah.
But just the numbers, it's just staggering. And I don't think COVID helped. I think there's a lot of leftover resistance or pain or just concern, especially kids.
Yeah, and actually, so I mean, what we're seeing the after effects of kind of 3 or 4 years of life-changing moments, and especially the development on children, whether it's like education levels or socialization, you can see that play out. For our clinic, we don't see children actually; it's 18 plus. What we found is, for the most part in Vermont, children have access, through Dr. Dinosaur to medical care.
Right.
So
I forgot about that. They're trying to, I think, expand Dr. Dinosaur, improve it this year. There's some bills up there which I'm 100% behind. Thank you, Howard Dean.
Yes. What a legacy from him.
For sure. Yeah, everybody knows about it. I mean, it's just something that other people in other states have heard about if you have kids. Dr.
Absolutely.
Dinosaur.
Yeah.
So I think you just mentioned this, the NAFC.
Yeah.
That's what you all belong to.
Oh, so the NFAC is actually the
different?
National Association of Free Clinics. So in Vermont, we have the VFRC, which is the Vermont's Free and Referral Clinics, and the National Association of Free Clinics.
And do you guys get together every so often and learn from each other? And
I haven't been to one of the national conferences yet. I'm really looking forward to, because learning from these other directors across the country. I love getting together with the Vermont directors, because we're a board, and I'm currently the board president, and I feel strange because I'm the board president, but I'm often in rooms with people who've been doing this for 10 or 20 years, and I feel like I have so much to learn from them.
That's good that you know that, and I'm sure they appreciate the fact that you will ask. That after 20 years, they can share with you.
Yep.
I've been looking at my notes, and what does underserved mean? What category? I get the uninsured.
Yeah.
And low income, but what's that?
Yeah, I would say
underinsured.
This is how we typically describe people who have health insurance, whether it's Medicaid or maybe a private plan, but for some reason or another, they're not accessing care. And sometimes it's they can't find a primary care provider. Sometimes it's they can't afford the out-of-pocket costs associated with that plan. We have a few people who are on like Blue Cross plans, but their deductible is like $8,000.
Yeah, right.
So they're kind of coming to us for some of the smaller tests, and maybe until they hit their deductible, like mid-year or something like that. So, so increasingly, like as I said, about half our patients are what we call underinsured.
That makes
They're
sense.
on Medicaid, but they can't get the benefits of being on Medicaid because they can't find a primary care doctor because none of them are accepting new patients.
No, it's scary.
It's really challenging.
I've had my husband and I both had our doctors retire.
Yes.
Going 25, 30 years to the same guy. It's hard, and it's hard to start over with the new one because your other doctor knew you. All you had to do was show up and he'd take care of you.
Yes, right, exactly, because you have this relationship built up with them. Yes.
So I thought I lost my brother or something. It was really funny. So if people are listening and really saying, hey, could they call? How do they know to volunteer? Do you have somebody? Is that the community outreach person?
They could just give us a call and tell us they're interested in volunteering. We do have a form on the website, so some people fill out the form, and then we contact them. And we're not just looking for doctors and nurses. We always need more doctors and nurses, or counselors, or whatever someone wants to offer in terms of medical care. We will help you get there. But we do need just non-medical help. Honestly, Pat, I run the front desk at least twice a week. week, you know,
right.
which I honestly I do love because I get to know the patients,
Right.
I root for the patients, you know, and that's some of the most fulfilling work that I do there. But the reality is when I'm running the front desk, I'm not raising money and I'm not really kind of managing the staff and
Right.
doing long-term planning, all the things you want an executive director to do.
Right.
And so if someone wants to help us out volunteering at the front desk, you know, greeting patients, doing scheduling, pulling the charts, and then you work in this environment where you finish your day and you're like, wow, I feel good because I helped a bunch of people and they're walking out feeling positive about their health condition.
Yeah, isn't that great? That's good for you. All right, so let me know about this Bob Dylan contest.
Are you a Bob Dylan fan, Pat?
No, but I think I'm a little bit before Bob.
Yep.
But anyway, that was like it's back, and everybody, all the things are wild, sort of. What is this?
So apparently this has been happening for many years.
Yeah.
I think at least since the early 1980s is my understanding.
Wow.
And this came back, this is the first time it was back after COVID. So this was essentially a Bob Dylan concert. You know, we had 12 musicians signed up. They all played Bob Dylan songs. Some of them dressed up like Bob Dylan, which was a lot of fun. Yeah, like, you know, wigs and everything. It got really kind of crazy. And so it was just a night of music. And, you know, everything went to benefit the People's Clinic. So we raised about $2,500.
That's not bad.
Not bad at all, especially for our first year back.
Yeah, right.
And the organizer said, Dan, we want to do this every year for you.
That's great.
So this is going to be a permanent concert in benefit of the People's Clinic, which we are so excited
And you
about.
had how many contestants?
We had 12 people.
That's great.
Yeah, and ended up, and there were judges. Like they judged how good. They had different criteria. Like, did you sound like Bob Dylan? And like, did you look like Bob Dylan?
That's funny.
And it ended up being a gentleman who came down from Maine to compete, who won. Yeah.
Oh, that's funny.
Yeah.
Whoa. When is that? Every year, about what time?
It'll be around April, I think.
really?
So it just happened last Saturday over at the Grange, the Capitol Grange.
Yes, I read that, yeah.
Yeah, and they end up being becoming a sponsor and gave us the space for free, which is also a great benefit.
Great.
Yeah.
Isn't that great? The Grange is an untapped resource. We use it from Berlin a lot.
Yep.
We have a deal with them. And it's a great building. They do a lot of stuff over there.
Yeah, my wife goes contra dancing there.
Oh, does she
Yes.
really?
Yeah.
Oh.
Yeah.
We used to do square dancing every Friday night where I come from.
Yeah, and I think square dancing and contra
It's
dancing are a
very
little bit
close.
similar. Yeah.
It's a little it's close. I'm sort of the same music of sorts. But anyway, I was a square dancer in my youth. We go with mom and dad and
Fun.
had a great time. And so I'm just going through my notes here, but you do a lot, and I think you work with the Shauna.
Oh, Shauna Trainer?
Trainer, yeah.
Yes, yeah.
Isn't she great?
Fantastic,
I
yeah.
interviewed her. I met her at our church, and then I interviewed her on the radio. And that LGBTQ, what is it? The Rainbow
Bridge.
Rainbow Bridge.
Yeah.
They did more stuff after the flood here. I was blown away by how much they helped. And you'd see their signs all over that they were out there. And I thought, good for them.
Yeah, absolutely. Shauna became kind of the face of flood recovery for Barrie. Not only, you know, hosting things happening in downtown, but like doing these, you know, Facebook Live videos and telling people where they can go to get help, helping people navigate the confusing bureaucracy, you know, to get the help. And the work she did was incredible. I'm lucky Shauna's become a great friend as well. I'm constantly inspired by her.
Yeah, every time, once I met her in church, and then I said, oh, you've got to come on the show. So she came on, and since then, I'm just more conscious of the group and what they're doing, and they really deserve some serious recognition. I hope that the city did something because they were out there all the time.
Yeah, no, it was really a blessing. I don't know how the recovery would have looked without. Like they just, I think, saw an opening and stepped right in. Someone has to do something, you know. So
it was great. So, but you offer a lot of services for the LGBTQ. Oh, you use, I love it, 2S.
Yes.
You're the first group I saw that put 2S LGBTQIA+.
Yes.
I have a very good friend of mine. He's the chief of the Mohegan Abenaki, Don Stevens. And so we talked about the 2S, which means two spirits.
Yes.
I know this. And,
Yes.
And I haven't seen it. And I saw it on your website, and I said, oh, good for them.
Yeah.
Because I yelling at them one time, Jeffrey.
Yeah.
I said, I just learned LGBTQ.
Yeah. Yeah.
Well, you quit adding to it because it took me a year to be able to just say it and do it correctly. But I saw that, good for you. I love it.
Yeah.
I think it's cool.
Yeah, and we I think it was about a year ago we got a small grant from the United Way,
Right.
and this was one of the things I was thinking about, Pat, when I started this job is that healthcare historically has a really bad history when dealing with whether racial minorities or people who are kind of maybe on the edges of society, everything from downplaying medical conditions to outright experimentation,
Well, yes.
And so I felt like I had a responsibility at the clinic to say, okay, who's not walking in here who could get our services, and why aren't they walking in here? So we had to, so everything, it wasn't just serving, the Two-Spirit LGBTQ plus community. It was, migrant farm workers. We see a lot of folks, come in from the local farms and looking for care. What are we doing with BIPOC Vermonters? And changing some of the language you use, changing the forms. But this United Way grant did allow us to get a couple of our volunteers trained in how to work with folks from the LGBT plus community. And so once a month we have a clinic where we have a provider who has that training, and we'll have those folks, and then we'll do the same thing for migrant farm workers as well. We'll partner with, we'll get a provider who is fluent in Spanish. That's usually the predominant language, so there's no language barrier. We do have a translation service we can call up, but you know how those things are. It makes things worse usually.
Yes, they do. Well, we won't get into that. But and where do you live, dear? Where? No, that's wonderful. I'm sure the community is really appreciates that.
Yeah, it's been really great, and it's nice to see, especially with the LGBTQ plus community, like the word of mouth. Like someone has a good experience at our clinic, and they tell their friends, and then they just come and like, oh, so and so told me I'm welcome here.
Right.
And we're like, yes, you are. You know, everyone is welcome here, and we're going to meet people where they are. So. But
it said, and I'm only asking this out of complete ignorance, where you said gender affirming.
Yep.
You're offering gender-affirming training. What does that mean?
Yeah, I know.
I'm just going to ask.
No, I appreciate, because I think there's a lot of confusion when people hear gender-affirming care, and I think a lot of people instantly think of surgery, right?
Right.
And it really that's such.
Hormone shots or whatever else, I don't know.
Right, and really gender-affirming care, very broadly, it could mean anything from like mental health counseling to help a person, come out of the closet. Or it could be legal help, like helping them change their name or, get some documents updated. It could be any of that. Again, we don't do surgeries or anything.
Respecting where they are.
Exactly, So for a lot of our patients who are seeing us for gender-affirming care, sometimes it's just they're looking for a doctor who knows their community and can talk the same language. Or maybe they are coming to us for maybe hormone therapy or something like that. Or maybe sometimes it's just, again, they feel welcome because sometimes maybe the provider is also from that community, or they've just had lived experience. I often find that some of the best providers, like you find out afterwards, like, oh, their son or daughter is gay, and that's kind of why they feel very comfortable working with these folks. So.
Good for you, Dan. That's great. I'm impressed. Because it's a learning curve for some of us who are perhaps older than dirt, as they say.
Yeah, and I appreciate that, Pat. And I think, folks on my side sometimes have to learn a level of patience. And I still make mistakes, right? Like I might misgender someone, and I just learned that the best thing to do in that moment is to say, I'm sorry, you correct the mistake, and you move on, and you try not to make that mistake again. If you kind of linger on it, it makes it uncomfortable and weird.
They're very understanding. At least, certainly the people I've met in this area, they're very understanding, and they'll laugh and tell you, no, maybe you should do this or that. And I'm like, okay, because I want to learn. It's not that I don't want to learn. I want to learn, and I want to be respectful.
Yes.
But You know, some of these things have gone by me because I haven't been in the workplace either for quite a while. So that's where you learn most of this stuff.
Yeah. And I think, I've been putting my, pronouns in my email signature probably for almost 10 years now, and even when I first started doing that, that generated a lot of conversation with other people I was dealing with in the business world, They're like, what is this? Why is this happening? And I think that was an education moment too, so.
That's cool. Yeah, but I do have struggle with they, them. I do.
Yep.
It's hard for me, and I know I love the 2S, I get that part, but it's hard for me to say they, what do they want?
Yes, yeah.
It just goes against my grammar.
Yeah, and I totally...
Sister Marinita's turning over in her grave here.
But I think what's important is, like, as you said, you want to learn and you want to be respectful. And unfortunately, like, not everyone's coming from that perspective, So...
Well, they deserve respect. And
absolutely,
so they should get it.
Yeah.
And I don't want to add to it either.
Yep.
So anyway, that's really great. And I think there is a fairly large community here.
Yes, yes.
And they certainly, I'm sure, welcome whatever support you can give them. Let's see, we've got about 13 more minutes. I know you were working with the Aldridge Public Library.
Yeah.
That sounded really cool.
Yeah.
What is that? What are you two doing together, you and the librarian?
Yeah, so we opened up a little, I've been, Pat, I've been a reader my whole life. My mom read to me when I was a kid, and I love books, I love literature. Yeah. I grew up going to the library. I grew up in Nashua, New Hampshire, and I went to our public library after school almost every day. And I'm also a member of Barre Rotary as well, and the library is a big beneficiary of the work that Barre Rotary does. And so I end up becoming friends with the assistant library director at the Aldridge, Garrett Grant, and we started this little project. So we have a little mini free lending library right in our waiting room. I wanted people to get off their phones in the waiting room. So we have one of those little mini libraries on a wall, little bookshelf, and the Aldridge will bring over books. Again, it's all free. And so people can take stuff. I love it. Our nurses will bring in books to leave. There was some Stephen King there the other day. I think that went pretty quickly.
Yeah, I bet it did.
Yeah.
That's great. And I wasn't sure when I was reading about it what they were actually, because you were saying free, but they're really free. They really are. Yeah, I mean, again, everything is free at our clinic, That's great. I've got to find that there was a couple of other things you did on my little list here. Here it is. That I was trying to talk about, because I think you must have different programs or classes, like say the smoking cessation.
Yeah.
Is that a group? Sort of.
Not at the moment, but it's kind of integrated into our work at this point.
Is it?
And it's interesting you brought up the smoking cessation, because we're kind of in that waiting period where we're seeing how federal changes will impact our work. So last week we got word that the entire CDC department that managed our tobacco cessation grant, they're all gone. And so, the money did come through the Department of Health. I know the state has some money. They're going to try to backfill a little bit. But for us, and, again, we're not sure if we're going to be able to continue this work. This paid for patches, gum, the stuff that will help people kick tobacco. And it was incredibly popular and is integrated into our work. So if a nurse brings someone back, finds out they're a smoker, they're going to give them the literature and say, hey, we can give you the patch today. We can give you the gum today. And then our dental hygienist does the same thing when she brings patients back and she finds out they're a smoker. It's been wildly successful. And unfortunately, this stuff's actually pretty expensive, like the patches and then the gums and stuff. So this grant has allowed us to buy that merchandise and give it free to our patients.
Excellent.
So
that's good, because you've got to keep at it. You know, when you get into smoking cessation, you just don't go to one meeting and off you go.
Yes,
so that's hard.
It really is hard. I mean, people who I think kick tobacco, I think, is one of the hardest things to do.
I don't need to. My mother smoked. My mother and dad smoked like forever.
Yeah.
I think we grew up with the secondhand smoke in the back seat of the car. But I never smoked. But when she stopped, she was ridiculous because she didn't know what to do with herself after dinner. Because that's when she got the thing, had a cup of coffee. So she started clearing the plates. Even if you weren't thinking, too bad for you. And you go, Mom. So we got her out of that habit, so.
That's funny. Wow.
Well, it's.
Right, you have to
it's
replace
who
that
you
habit
are.
somehow. Yeah, and I've talked to smokers who were like, had to give up their morning cup of coffee because that was the trigger, you know?
Right.
So, yeah.
I never smoked. I don't know why, but I never did. Or maybe it was a secondhand smoke.
You had enough as a child, yeah.
Exactly. So you also do eye care, vision screening. That's important.
Yeah. And so there is an optometrist in Barrie who we have a great relationship with, and he will give one free exam to any of our patients.
Perfect.
And because we don't have you need a lot of equipment to do kind of in-house eye exams. Right. So even if we found an eye doctor who would volunteer in the clinic, we would have to spend tens of thousands of dollars to get that equipment.
For the equipment, sure.
And we had to do that actually when we started doing the tooth extractions. We spent about $15,000 buying new equipment. We fundraised for that. So we do have a great relationship with an eye doctor in Barrie, and our patients can go get one free eye exam.
Great.
Again, but you also have that gap of paying for glasses, you know, which could be a couple $100 depending on what prescription you need.
And we don't allow that money to be like you were just talking.
With folks on Medicaid, that's a good question. I don't know. I should check on that.
Why don't they just give you the money and say do whatever you need with it?
Sometimes I think that might be the best thing.
That?
Yeah.
Don't put any restrictions on it.
Yeah, because I think sometimes people know best what they need, right?
Yeah. Oh, there's a concept.
Yeah.
Yes. Yeah, because I think most of them, the people that I've met are just, they're just nice.
Yes.
And they don't, they're there and there you are, and they don't want to be there.
Yeah.
They just want to live and have the things that other people do. So.
Absolutely. And it's funny, Pat, I was thinking about, we often has this phrase like, oh, I'm going to see the doctor, or the doctor's seeing me. And I was thinking about what we do at the clinic, it's more than just a checkup. And when you're seeing a doctor, for a lot of our patients, it's about being seen by your community finally, recognizing that you have value as a person, despite maybe, your background or social economic position. So I've really been thinking a lot about just the idea of being seen. And for some of our patients, seeing the doctor and seeing a doctor who will listen to them, that is one of the few moments they might feel seen by their community as a person.
Yes, because I'm sure when they're on the streets, people choose not to see.
Yes.
They just walk by.
Yes, yeah.
Well, this has put a whole new light on things, Dan Barlow. I hope people are listening.
I hope so too. And Pat, again, I really appreciate you having me on. I love talking about the clinic and the work we do. And I have to again say, everything we do at the clinic would be impossible without our volunteers. Yep. It's amazing. We have doctors who started this organization 32 years ago who are still volunteering with us. They keep their license active. They're not seeing private patients anymore. The state does have a great program where they can get they can renew their medical license for free if they're just doing pro bono work.
Oh, wonderful.
So for our free clinics. So that's great for our providers. And again, we also have some providers who will finish a shift at the hospital
and come here.
And then come down and see us for a couple more hours. Yeah.
Well, how wonderful for them.
Yeah, it really is.
Oh, that's really great. I should pop my head in there for a minute.
Yeah, I would love to have you come by sometime.
I only come on Sundays, but you've got a lot of people going in and out of do they work on the weekends, these people?
We don't have anything going on the weekends usually, no.
Okay. But you do things like the Bob Dylan thing from time to time?
Yes, on the weekends. And sometimes we'll do a pop-up clinic we'll be having a few pop-up dental clinics, I think later this summer, which is really exciting. So
that's great. That's good. How do you reach out to these people, to this clientele? How do you reach them?
You have to try to advertise in as many ways as possible. So I found, social media, Front Porch Forum has been fantastic, actually. Word of mouth often. And, we have just kind of a running list of patients we know, and we know their needs. So we can reach out to some folks and say, hey, we're doing this. And they'll be like, I'm going to... they're going to get a ride from their friend or whatever they have to do to get there.
And I'm sure that community will spread the word.
Yes.
I presume it's probably a pretty tight community.
Absolutely.
They seem to know folks.
Yes, yeah.
So that's cool. So we just have about 4 minutes left, Dan. Do you want to talk about anything specifically? I know you've got, I'm just looking at this list, it's incredible. Breast and cervical screening, that's important these days for, and And so if you found that somebody had breast cancer, or they weren't sure what it was saying, but
Yep.
is there trouble? Do you then call up the hospital and get them seen by somebody?
Absolutely, yeah. So usually with like Pap smear mammograms,
Yep.
we can take the sample at the clinic. We usually have to bring it up to the hospital to
Yep.
have the analysis done, and then we work very closely with the hospital to get them into treatment if that's the situation.
Oh, that's good.
I think we could do more as a society on preventative care.
Yeah.
There's a great program that we're part of. It's called You First, and helps people pay for Paps and mammograms. But the income eligibility is like so low. It's almost like it hasn't been raised in so long that it's created this huge gap between the people who have private health insurance
Right.
and they're fine,
Right.
and then there's people in Medicaid, so they're going to be okay too, and this gigantic gap for people who are maybe earning $40,000, $50,000, $60,000 a year, but don't have insurance.
Right.
They can't get that preventative care.
Right. Wow. Well, I did a show quite a while ago, but it was all these doctors from our hospital here and also in Burlington, and they were talking about a new sort of approach, which really is pretty much what you're doing, the whole person.
Yes.
Like you don't just deal with the breast cancer, but you deal with what do they like to do, exercise. I
Absolutely.
mean, it's a whole new way of looking at health, and I think it's very holistic, and it makes a lot of sense to have the patient think not just of one problem you've got,
Yes.
you got a leg broken or something, but to think about from head to toe and fix it.
Absolutely, yeah. We call it the social determinants of health, and it's everything from like what you're eating is impacting your health, where you're living, like your childhood, where you grew up. Did you grow up in a house that maybe had lead paint, for example?
Right.
All these other factors that a person maybe doesn't really have control over,
Right.
for parts of their life
Yep.
that greatly impact their health. Which is why I think it's so important we have Stephanie on staff who does, someone comes in, they don't know where they're living that night. She's going to help them fill out the forms that they need to get in line for either whether it's a room or a temporary shelter or something. So
And we get discussing about that motel thing.
yeah, that's a
can't-
whole, yeah.
I'm sorry, you do not let people leave a hotel in the middle of winter. Sorry, just thought I'd
No.
throw that out there.
The calls we've
What are we-
had over
what
the
are-
past few weeks, because we often get people with the forms that they need a doctor to evaluate them and confirm that they have a health issue that would
Yep.
keep them in the room. The calls, it's heartbreaking, the calls we've gotten over the past few weeks. Like, they call our clinic, they had just gotten kicked out of the hotel, they're in the parking lot, and someone's handed them a tent,
Right.
and they're like, where am I supposed to go?
Right.
And they're crying to you on the phone, and
Oh,
there's
damn.
nothing, like, all the shelters are full. I call Good Sam, and they're full. And it feels so, you feel useless in those moments
Sure.
when there's nothing you can do. It feels very powerless. Even more so for the person who you can't help.
Because we actually lost 2 couples this year.
Yes.
Died at nighttime
Yes.
together, but it was in a sleeping bag or something, and just too cold.
Yeah. Pat, I love camping. Sometimes it's cold in the summer at night in Vermont. Okay,
And damp
so.
on the ground.
Yes.
And
Yeah.
Right.
And I'm on the Berry City's Unhoused Community Committee, I think is the
Right.
name for it. The city
Yeah.
council just created it. And one of the things we're talking about right now is obviously there's people are camping right now. We know they're out camping. Is there something we can do to help facilitate that? It's
Right.
been suggested maybe camping platforms somewhere just to
Right.
get people off the ground.
Right.
Like that little level of humanity could go a long way for some of these folks.
That's a great idea.
Yeah. We're looking at what the liability issues might be.
Who's the head of that? Is that Tess Taylor?
So Tess is great, and I actually had dinner with Tess last night. So she's the city liaison working on
Right.
homelessness issues for the city, which has just been renewed funding for a second
good, I'm
year.
glad.
Me too. She is a miracle worker. So yeah.
She's very active in our church, and it's all about
Yes.
helping people with, that's the warming center. She's sort of in charge of that.
Totally.
Yeah.
It's really having her there as kind of the person who's pulling everything together, making sure the communication's working. It's I don't know how we do it without her.
Yeah,
So.
well, and she will listen, and
Yes.
I'm sure that makes, as you were mentioning, just see me.
Yes.
I
Yes.
love that.
Yes. Yeah.
That's really good. Well, anyway, Mr. Barlow, I really want to thank you very much for being on the show. I learned a lot, and I hope folks found this of interest. I'm sure they did. Could you give a phone number or a website or?
Happy to. 802-479-1229 is our phone number. We are closed on Fridays, so you can leave us a message tomorrow, or go to our website, phwcvt.org. Again, phwcvt.org. And Pat, I just want to say thank you again for having me on. It's always such a privilege to have these conversations with you.
My bad that it was so long. Listen, this is Pat McDonald, your host for Vote for Vermont, where our tagline is listening beyond the sound bites. See you next week.